between communicable and non-communicable diseases. Communicable diseases such as those induced by virus, bacteria, fungi, parasites, and Archaeopteryx fungi, parasites, Archaeopteryx such as malaria, such as Chagas disease. For example, which infectious diseases are not communicable? Which infectious diseases are not communicable? Are not communicable. It's related to not respiratory tuberculosis or intestinal tuberculosis, for example. That cell arsenic, disseminated tuberculosis. But we put all of them in communicable category, okay? And another category is non-communicable diseases. It means not transmitted from human to human. For example, diabetes mellitus, cancer diseases, heart attacks, and so on. But we have some non-communicable diseases that could be transmitted from a people to another. For example, kidney diseases. Which kidney? For example, kidney stone.
Yes, maybe.
Kidney stone may be familial.
Liver virus.
Liver virus, yeah, hepatitis. So some cancers, such as liver cancer or hepatitis carcinoma, could be caused from a hepatitis B or hepatitis C or hepatitis D. But we put them under non-communicable diseases. Okay? Communicable diseases and non-communicable diseases. Is communicable and non-communicable diseases related to socio-economic of the countries and people? Is there any relationship between wealth and type of disease?
Yes.
Yes, of course. How? Which diseases are for poor people and which diseases for wealthy people, rich people? Diabetes is for rich people, okay?
Heart disease.
Birth disease, heart disease for rich people, blood pressure for
Cancer also for
Yes.
people.
which
Cancer.
cancer diseases for rich people. So, which diseases are for poor people? Huh? Hepatitis, tuberculosis, infectious diseases. So we all agree that the communicable diseases is related to poor people, and non-communicable diseases are mainly for rich people. But rich people know how to treat the disease and escape from the disease. And we in Iran said we get diseases like rich people, but die like poor people. Yeah. In the new categorization of the diseases, there are some diseases in the non-communicable diseases that are related to poor people. For example, events around the birth. For example, malnutrition. Malnutrition is non-communicable, but it's related to poverty. And congenital abnormalities are also related to poor condition, but it is under non-communicable diseases. So in new categorization, they draw the malnutrition and birth abnormalities from non-communicable category and put them in the communicable diseases. And also, they produce a new category mainly for males and name it violence and accidents. So in communicable diseases and non-communicable diseases, the male and female affected equally, but in violence and accidents, mainly males are affected.
Most of them.
Much?
Most of them.
Most of them. Okay. There are a transition between non-communicable diseases, from communicable diseases to non-communicable diseases because of the overall raising of the hygiene and raising the life expectancy. Okay, so most of the countries are prone to non-communicable diseases, and because of the antibiotics and vaccines, the communicable diseases decrease. So there is a transition between communicable diseases to non-communicable diseases. In category of non-communicable diseases are heart diseases, stroke, means brain infarction, cancer diseases, and coronary respiratory disease, chronic respiratory diseases, and maybe chronic obstructive respiratory diseases. Chronic obstructive respiratory disease is related to smoking, just smoking, and diabetes. These 5 examples are main causes of death in the world in category of non-communicable diseases, and all of them have a common risk factor: males, obesity, alcohol usage, low physical activity, and eating habits, high carbohydrates and fat, low vegetable and fruits. Okay? So if we control the risk factor of the disease, we would gain more effect to control the disease. Here is the life expectancy. Unfortunately, Africa have a low life expectancy. So in Corona, the Africa have good chance. The death rate of COVID-19 was low in Africa because old age people are in other countries, not in African region. However, unfortunately, the low life expectancy in Africa is related to which disease? HIV/AIDS, unfortunately. Yeah. The frequency of infection with HIV/AIDS is very high in Africa. And most transmission route is from mother to is neonatal. Yeah. Okay. This is the 3 categories: communicable diseases plus maternal and neonatal conditions and nutritional diseases. This, here. Disease comes from non-communicable to communicable diseases. And we have other non-communicable diseases and injuries, violence, and accidents. Okay. Yeah. The communicable diseases are responsible for 1/3 of death over the globe. the list of 10 causes of death. Yeah, I will update this slide for you. But in comparison between 2 decades, from 2000 to 2019, the hollow circle is related to 2000 and the solid circle is related to 2019. The blue one is related to non-communicable diseases, the green is for communicable diseases, maybe the black is for injury that's absent in 10 first causes. So ischemic heart disease or heart diseases increased in comparison to 2000 and is the top responsible of death. Then brain stroke or stroke, chronic obstructive diseases. So the third one are all of them related to non-communicable. 4 and 5 is related to communicable diseases, lower respiratory tract infection or pneumonia. The cause of pneumonia is virus or bacteria, so it's communicable. Neonatal conditions is new category of communicable disease. Again, cancer, lung cancer, Alzheimer. Yeah. The diagnosis of Alzheimer's something 3 times in comparison to 2000. 8, diarrhea disease, diabetes mellitus, and kidney diseases. So, as you see, only 3 communicable diseases are present in 10 most responsible diseases for death. One important thing is that do you know any diseases with low mortality and high priority in the community? Any health condition with low mortality that is very important. If you rank the diseases according to the mortality, you will miss it. Which diseases are important but not fatal? Yellow fever is a communicable disease. And maybe it has some mortality.
Polio.
Poliomyelitis. The frequency of polio is very low. Now, asthma. Yeah, you are right. Asthma may be important for who affected, and many people are affected with asthma, but it's not fatal. Which other disease? What? Any suggestion? Some important diseases with no mortality or very low mortality. Alhamdulillah, there are no important diseases, no mortality.
I don't remember any just like this.
Hepatitis, also it's not mortality. Crohn disease. Cooking. What? Only those who are affected know the migraine or headache.
Headache.
Other. What? Fever. Fever is a sign of a disease. Sorhanek. Measles. Measles or rubella. But infectious diseases have some mortalities and they rank by their mortality. آبله مرغان میشه chicken pox. Yeah, chicken pox. Most of them lead to cure and some of them with some mortality. So they have mortality, low mortality, and are not more important. And in some countries, they introduce vaccine of chicken pox. So
some dermal disease.
some dermal diseases, yeah, especially for young people, it's very important. Acne. Depression. Anxiety.
Stress.
Anxiety.
And stress. The stress of the class, the stress of the examination.
Mental health.
But doesn't this have a mortality rate, like because of depression, more people commit suicide?
So there is no death, but it's very important for you and me and for all the
Like, you're saying that it doesn't have a mortality rate. We don't consider suicide as death due to depression.
Oh yeah, you are right. Depression have some mortality, but it's very small. We said, especially after COVID, about half of the people have some abnormalities in their mentality, yeah? But the mortality is not high. And after you work beside the units in your office,
Mental health.
you will get some diseases related to dentists that affect your work, but not
Back pain.
back pain. Yeah, musculoskeletal pain and back pain.
Now I have back pain.
Back pain. Yeah.
Yes.
It's very important. Very important. Okay, so think about how we could, oh, nobody says,
What?
caries.
Oh,
Yeah,
can?
defend your specialty. Kuch degi dandu. All of it, yeah. The dental caries is the first prevalent communicable disease in the world. The most prevalent infectious disease is dental decay because the plaque consists of the bacteria. So then the dental disease is a communicable disease. But without any mortality. How we can bring these important diseases in this list? So we should think about something else rather than the mortality. And what's that? Healthy people, perfect healthy people, have one score for 1 year life. And a dead person have a 0 score. Okay? Now, think about the diabetes mellitus with insulin injection. I'm the God. I can change your diseased life with healthy life.
How?
How? You will have diabetes mellitus and you will use insulin
Right.
in 2026.
Okay.
I can change it with one, no, not 1 year. I can change it with a healthy situation, okay? 1 year with diabetes and insulin injection, you can exchange it with some months without diabetes.
Right.
So, this is a gambling. Give me your 12 months with diabetes, and I will give you some months
Okay.
without diabetes. How many months do you want instead of 12 months with the disease?
Same 12.
Same 12?
Maybe more than 12?
More than 12? you will give me 12 months with the disease, and I should give you a healthy months. You want more than 12 months? 6 months?
11.
11, okay?
I want full 12.
Good. So you are happy with diabetes mellitus? I will not change it. So
6.
10, 6,
Six.
good. Now think about more severe diseases, for example cancer. انشالله که برای هیچ کدومتون پیش نیاید.
Inshallah.
چی میگین خدای نکرده؟
نکرده.
خدا نکنه
خدا
چی میگین؟
نکنه.
خدا نکنه.
خدا نکنه.
خدا نکنه. شما چی میگین تو کوستاریکا؟ خدا نکنه. Inshallah not happen for you. چی میگین شما؟ Spanish? Dios no quiera. Dios no quiera. Not happen for you. So, 1 year with cancer. Yes, the guys. 12 months with cancer. I will change it with some months in healthy situation. How many months do you want? It's fair. So, if the condition more severe, the gambling is performed with less months in healthy situation. We said the weight of disability. So, severe conditions have a greater weight and is near to 0
Right.
and death. And for non-severe cases, for example, caries or influenza or COVID, the weight of disability is low and is near to 1. So there is a gap between perfect health situation and a disease. We said that the death get it 0, but the disease have some disabilities according to the severity of the disease. So, from 0 to plus 90, for example, 100% of the people, for example, in Iran, it will start from here to here, okay? If we have a standard for living, here is the gap due to death. Gap due to death. Life lost years. Life lost years. And the people under the care are not completely healthy. Some of them have some diseases. So here is a gap due to disability, not death. So we said here, life lost due to disability. So we lost some years due to the death and some years due to disability. If you lost them, it's equal to dying. disability adjusted last years. Disability adjusted last years. We said as a burden of the diseases. Burden of the diseases. Now we rearrange the diseases according to the burden of disease. Yeah, here is the categorization of countries: high-income countries, low-income countries, middle low and middle high, and you will see that, for example, in low-income countries, the green diseases for communicable is high, and and here for high-income countries, only one communicable diseases are here as a leading causes of death. But there are some examples of the health indices for different countries: Iran, Iraq, Germany, Pakistan, Nigeria, and so on. Yeah, here is the global disease, death causes, and this risks and burden here. Here is the burden of disease. For example, in 2019, the first one was cardiovascular diseases and neoplasms, which neoplasms in 2010 was the third one, in 2000 was the fourth, and in 1990 was the sixth. For dog. Then maternal and neonatal, other non-communicable diseases, respiratory infections, musculoskeletal disorders is the sixth one. Mental disorder is the seventh. Diabetes and chronic kidney diseases are the eighth. Unintentional injuries related to category of violence and injuries is the ninth. So, the rank of diseases change if you consider the burden of disease. Okay?